Let me need to.
Hello, everyone. Thank you for joining us for Safe Space, New Protocols for Reassuring Residents and Prospects with Lauren Wallace. Before we get started, I just want to ask you or let you know if you have any questions, please post them in the chat or the Q&A, and Lauren will get to those at the end of her presentation. And thank you, Lauren, for joining us today to present. I'm excited to learn more about safe space, especially in this environment. I did want to mention also that this session is being sponsored by Colorado Security Group. And without further ado, Lauren, take it away.
Thanks, Nancy. So for those of you who are joining, and for those of you who have already been here, please do not hesitate to ask questions. I'm definitely making sure that there's enough time at the end to answer them. As you know, there's no such thing as a stupid question. I am here to help you guys. So please, please, please ask, and I'll make sure that I cover as many different topics as you guys need from me today. So I am Lauren Wallace. I am a principal and the director of certifications and consulting at Epsten Group. We're based out of Atlanta. We have several people in different parts of the US and some in Mexico, some in Europe. Let's see, I think that covers most of it. But we're still pretty much a small group. We focus mostly on consulting. We have a huge commissioning group, building envelope group, and some others in our practice. But I have quite a few brilliant people working for me, and we've been focused on everything under the sustainability umbrella, which has been growing and growing and growing over the last few years. And you know, didn't know that in March I was also going to become a COVID expert, but here we are. So I know that there are a lot of you who have probably already implemented a bunch of different things for your spaces that you're in charge of, and that's fantastic. And I would love to hear if there are any successes or any failures, things you had to go back to the drawing board over once the presentation's over. But I want, before we get into this, for everyone to understand that the information that we know as of now, and don't hold your breath because it could change, and it probably will because we're learning more and more as time goes on, but the SARS-CoV-2, the coronavirus, the virus that causes COVID-19, can survive for hours in the air. And I don't know if we have any Florida Gator fans here, but you'll be happy to know that it was a brilliant group of scientists at the University of Florida who earlier in this summer performed some tests, and for the first time were able to capture whole virus particles that would actually be considered a contagion from the air, and as far as 16 feet away from the source. So I know that everybody knows, wear a mask, wash hands, social distancing, stay 6 feet apart. 6 feet is great, but it's not the silver bullet, right? So the majority of what I'm going to talk about involves the fact that this is an airborne virus. I know that once that missing piece of data came from University of Florida, both the CDC and WHO went back and revised some of their advice, some of their information. I've noticed that both of them say it may be airborne, but many scientists, many doctors, people that are featured on different news sources all the time will all agree, just even based on some of the super spreader events that have happened, that this is certainly an airborne virus. So what I think is important, though, to talk about is whatever you're doing in your space, whatever you're hoping to learn today, we're all trying to mitigate risk, right? And there are different actions that we are taking or that have been suggested that really actually do mitigate risk. And some of them are just perceived. But no matter what we talk about, I don't want the ones that are perceived to just be, cast aside, because your job is to make everyone feel safe and for everyone to feel confident in what you guys are doing to help mitigate risk. And sometimes those things that are just perceptions but aren't actual tried and true methods give that perception. And so in my opinion, they are 100% okay. Move forward, truck ahead. Let's talk about those. But I want you all to also understand which ones those are, right? So if you have been following any of the news, you've probably come across my friend Joseph Allen, Dr. Joseph Allen. He's been on so many different news outlets. He's been interviewed by different people because he has for years been studying basically public health and pandemics and pandemic viruses and how they act. And so from day one, people were reaching out to him, asking him about COVID-19 specifically. But really, what I hope to, I guess, have everyone understand is that regardless of, what your beliefs may be, regardless of what people in your community are doing, what your family's doing, regardless of what your political beliefs are, there's definitely a lot of things I'm going to talk about that some people feel very skeptical about. But at the end of the day, again, there's no silver bullet. And even Dr. Joseph Allen says that it's a layered approach. So let's jump into some of these. So temperature checks. And if you're not afraid to get in the chat window, start, I'm always excited to see, what people think, if these are some perceived or actual techniques. So temperature checks, I'll go ahead and tell you while you guys are warming up your typing fingers. Temperature checks are absolutely a perception. If someone is asymptomatic, they are still contagious and they may not have a temperature. However, I can tell you from the people that I know, the people in my family, one of the first things that will come out of their mouth is, oh, they're really serious if you go there. I mean, they're checking everyone's temperature as soon as they walk in. And I'm like, that's great. But what are they doing if someone does have, a slightly elevated fever? And I don't know about you guys, but if I have a fever, which is associated with typical symptoms, it's, that's over 100 and I am not going anywhere. So I am down and out. So temperature checks, fantastic in terms of perception. They are not something that's absolutely going to mitigate your risk. Cleaning high touch surfaces. If you're not familiar with the term high touch, the CDC has, and you can Google this, it'll pop up really easily. There are surfaces that are touched often, and then there are surfaces that aren't touched as often. And the surfaces that are touched often are things like doorknobs, elevator buttons. Depending on your space, like in my office, we have one trash can that you can step on. Great, you don't have to touch it. But most of our trash cans are a pull knob and hidden in a cabinet. So that's a high touch surface because I can't tell you how many times it's open and closed every day, right? So you really need to consider your spaces. You need to consider spaces where there's a lot of traffic, and think about the high touch surfaces and make sure you are cleaning them, and make sure you are cleaning them often. One of the things that is well known about the virus is that the actual film or layer of it is a lipid, and a lipid base, so it's a fat. This is why hand washing is such a great way to mitigate spreading the virus, or even like contaminating yourself or other things, because any kind of soap will absolutely break up the virus pretty quickly. you don't have to clean high touch surfaces with these, high alcohol-based products. There's tons of products out there that are a disinfectant that will kill, that are low VOC. You don't have to go through a space and electrostatic spray everything. Definitely focus on the high touch surfaces. But I think it's important, if you are cleaning them often, people in your building will see you cleaning them, and that also adds to the perception, which is great. Limiting person-to-person contact. So this is not just for the people who, live in or might potentially live in the residential spaces or even in offices. This is also for your employees. And some of the ways that this is happening, you see in a lot of different spaces throughout, your community, that they've put up plexiglass, and that's to limit, the amount of contact between you. Not a great way to mitigate the virus if you're putting up plexiglass between desks, because as we know, it's an airborne virus. But if you don't have to touch another person or talk face to face to another person, if your employees can do everything that they would do in an office space from home, let them work from home. Do whatever you can to limit that person-to-person contact. Some of the technology items out there are like key card activated. You can even use key cards to have doors open automatically, so people don't have to touch the doorknobs. I mean, there's all kinds of things that people are doing so that you can avoid the limiting person-to-person contact, but you don't have to spend a ton of money on all of this fancy new technology. Honestly, cleaning high-touch surfaces, limiting person-to-person contact, totally worth it. Please implement those things if you haven't already. Designated circulation paths. Does this work? Yes. So the idea is, if there is a clear flow of traffic, then you avoid potential gatherings of people. You're allowing people to space themselves to what they feel is adequate, because I think, as you guys may remember from a few minutes ago, I told you that 6 feet means nothing. But really, designated circulation paths are great if you have that kind of scenario where people might actually back up and have to wait for something. Or, I think you see a lot of it at the entrance to a store. They'll have, this is a designated in, this is a designated out, just so that there isn't any kind of pause in someone's flow in and out of the space. But otherwise, designated circulation paths, a little bit of a perception, just because the air is the air, and depending on what your air exchange is, it may be contaminated, and a designated circulation path isn't going to change that, right? Restricting communal spaces and restricting group gatherings. Y'all, I cannot tell you how many times I've seen, some apartment complex pools, it's summertime and we're outside, and they've told us that outside is better, and it really is. That's a real one. But when you're, talking to your friend who you haven't been quarantined with, and you're really close, and maybe there's some alcohol flowing, and now all of a sudden you're getting closer, there's just so much that you're risking when that happens. So definitely restrict communal spaces, restrict group gatherings. And along with this, which is another thing that we've been seeing a lot of people doing, is reducing the maximum occupancy. So I'll talk a little bit more in a minute about what you can do for some of these communal spaces, especially if they're indoors, that will make them safer. But no matter what, you should definitely consider reducing how many people can be in these spaces at a time. Perfect example, if you have a fitness center, it's really important for people to be able to work out. Everybody is stressed to the max, and working out and getting great sleep are two of the only ways that you can reduce your stress, but we want to make sure we're doing it safely, okay? And I don't know about you guys, I'm okay wearing a mask, and anytime I've been wearing it for a couple of hours, I just try and remind myself that there are people in hospitals wearing them for 18 hours on end, but there is no way I'm running on a treadmill with a mask on. So There's some other things that we have available to us. Hand washing stations. So if you can provide more spaces where people can actually wash their hands, that's fantastic. That's not generally the case, but setting up places where people can sanitize their hands with hand sanitizer is a must. There are all kinds of ways you can do it. You can attach it to a wall, you can have a freestanding unit, but especially if there is a designated flow of traffic. So say you park in a parking deck, you leave your car, you open a door to go into an interior hall. From there, you go up an elevator and then you walk down a hall to your unit. Put some sort of method for people to sanitize their hands before they go into those spaces, somewhere in the middle of that space, and preferably before they get to their space, but hopefully, and with some of the communication techniques that I'll be talking about, you should educate them about washing their hands immediately or using hand sanitizer once they get into their space. And that, I think, placing any of these hand sanitizing items where there are high touch surfaces is kind of best practice for trying to figure out exactly where these should be. Adding air filtration media, oh boy, that's like a whole topic in of itself. It is, depending on what you consider air filtration media, not a perception, an absolute real way to mitigate risk. But it kind of depends a little bit on what your air system looks like. And if you don't know what it looks like, then that air filtration media may or may not be helpful, but I'll get into that in a minute. So what is the real deal? Masks. I'm sorry if you're a person that absolutely hates them. And I'm sorry if you're a person who's like, oh, it's okay. It's not that, it's not uncomfortable if I, wear it under my nose. But masks are 100% the surefire way to protect yourself, to protect other people in the space. So please, please, please remove any other hesitancies you have and please consider this. So one of the things that I want you guys to understand is that with communication, and as someone who, your residents are going to look to help with mitigation and to build trust and to, be able to feel safe in their space, especially people who are considering moving. If you act as a leader, if you are the person who is wearing a mask, if you're wearing it appropriately, if you're telling people how to wear their mask or correcting them or asking them to please cover both your mouth and your nose, then everyone else will start to follow suit. And when they see you being strict about it, it will make them feel safer. One of the topics that we wanted to talk about is, this is absolutely a must for your employees, but then what do you do about people who are contracted, who are coming into someone else's space? Masks must be required for everyone who does not live in the space in which they're entering. It's especially important indoors. It may or may not be important outdoors, just kind of depends on the setting. Some masks are better than others. My sister-in-law, she's a second-year resident at the University of Cincinnati, and since March, she has been assigned to the ICU for the COVID floor. And for weeks after weeks after weeks of dealing with all kinds of patients, all kinds of numbers of patients, she has not gotten sick. And it's because the personal protective equipment, or PPE, works. They wear N95 rated masks. There are cloth masks that are out there that are not N95 rated. They're fantastic for stopping larger particles, things like airdrop, well, more so if someone actually coughs or sneezes in your direction, right? They'll cover your face, but knowing that this virus is floating around in the air that you breathe in when you're in a space that's not filtering in some other manner, you have to cover your face, okay? Let's see. So I wanted to let you guys know that the CDC does have a couple of documents out there. They're a little bit exhaustive and very lengthy, and they kind of just threw everything in the kitchen sink at you, and they're going to let people figure out what works best and what doesn't. So I'm hoping that this is at least trying to kind of shed some light on the ones that are working. But if you want, you can search for these documents. There's one called the COVID-19 Employer Information. There's also one that's great for residents, especially those who have roommates. And it's a guideline that's specific if you are living with someone who is infected with the CDC. Definitely look these up, look them over. You may want to take some snippets from these different documents to share with your residents, because education is going to be key. But really, washing your hands, covering your face, those are the best methods we have on hand. So a little bit more about air filtration. So if you do not know how your air ventilation system works, how air is heated, how it is cooled, please engage with professionals who can help explain what is happening in your space. I say this because I have seen all different kinds of air ventilation systems for multifamily, and for some of the projects I've worked on, sometimes air is shared between units, which is kind of frightening in this pandemic world. And I think anything that I talk about, the best way that you're going to be able to figure out what you should do next is to understand how air is circulated, how fresh air comes in, whether or not air is recirculated within the space, because using filtration media, and I don't mean the kind that you get from Home Depot that's, you know, just your like normal air filter that you would change out in your unit, but one that is rated by MERV, that's at least MERV 11 or better. A lot of air handling units can't handle high filtration media. So if you talk to someone who knows what they're talking about, they can tell you what your air system can handle. But this is one of the best ways to do it. One of the things that you can do if you have absolutely no idea, or it turns out that there's just not a great way to filter the air, is the plug and play or in space air purifiers or air filters that you can put into your space are fantastic for multiple reasons. So one of the things about these filters is they are typically outfitted with activated carbon filtration and HEPA filtration. HEPA filtration is the tightest woven or the strongest amount of filtration that we have on the market, but it is not typically okay to just slap a HEPA filter onto a residential air unit or even a commercial air unit, because it takes a lot of extra energy and a lot of extra stress onto the air system to pull air through it. HEPA filtration is very typical in hospitals, but that's because they have to clean the air, especially in areas like surgical units. The air is changed out constantly to try and remove any contaminants in the air, especially if someone's, open on the table, or, there's, I don't know, maybe they're sick and there's other things like happening in the air, but they certainly don't want to circulate that air, and the air that comes back in needs to be as clean as possible. But if you put a unit that is sized appropriately for the size of the room into your space, somewhere in the breathing zone, which is what we consider 3 to 6 feet above the floor, then it will provide an air exchange that is better than any ventilation system out there. If any of you have flown recently, I know that Delta has been doing a fantastic job with these great little, I think like cartoons that are showing you where the HEPA filter is on the plane, where the air circulates and how it moves throughout the cabin and goes through the filter. And then it also talks about the amount of air exchange. So just to kind of, I think maybe help explain what I mean by air exchange. For schools, typically by code, what a school should be doing is providing clean air every 20 minutes or having enough air exchange where the air within the space is taken out and cleaned or either mixed with more fresh outdoor air every 20 minutes. The majority of schools are not accomplishing this at all. The requirements for an office space are even less. And I can tell you, based on the work that I do, the majority of office spaces are not doing this. When it comes to residential units, whether it's a single family home or multifamily, none of this is happening. In a lot of spaces, the air within the house is what's being recirculated, and outdoor air that could help dilute the amount of potential contaminants is not happening at all. So again, look at air purifiers. There are a lot of things going out on the market, of course, because probably I don't know, one of the top Google searches that week was air purifier, and everybody's trying to jump on board. Ionizers are something that are out there, and they'll claim that they're releasing more oxygen into the air and they're cleaning your air. And it's kind of true, kind of not true. It's not oxygen, it is O3, which is ozone. And there is absolutely a limit on the amount of ozone that is considered safe for humans. And the majority of in-space ionizers release more ozone than is okay. So be careful about these units. Ones that say they have UV light filtration. Understand that the strength of the UV light certainly means something, but for most UV lights that are actually safe enough for humans to come into contact with, have to at least have a 30-second exposure to whatever it is you're trying to kill. And if air is being sucked through a unit, passing by this light really quickly, it isn't doing anything for you, okay? Let's see, what else? So, come on, presentation, there we go. There are a couple of entities in my space, anyways, ones that I'm sure you guys in the building industry have heard of, that have focused on health and wellness within the built environment. As a response to the pandemic, both of the ones that are have more of the market share, I guess I could say, have come up with a COVID-specific or pandemic-specific response. They are certificates, they're third-party verified. They've taken aspects from their rating systems that they had included to help reduce virus transmission, but they've also talked to the scientists, to the health experts, and asked, what are some other things that people can do? They're very inexpensive. They are good for a year, and at the end of a year, you would have to revisit your documentation, see if anything changed. Who knows? The information we have about coronavirus may have changed, and there may be some new things that they want you to edit. But what these certifications or rating systems are doing are they're providing this added bit of insurance or trust, I guess, in a space that is focused on trying to make sure that there is a safe way to enter a space. They give you decals that you can stick on doors so that, the point at which someone walks in, they see, oh, it's been certified. So, I should be okay, or I should be relatively okay. Again, wear a mask, wash your hands. But these are fantastic. Definitely take a look at them. For multifamily, I would look at Fitwell. only because they have been focused on the multifamily residential space for a long time. Some of you who are on the call may actually have some spaces within your portfolio or some assets that have gone through WELL certification, the full certification, not just the viral response module. But WELL's health safety rating system is very robust. There's 21 options and you only have to pick 15. It's really inexpensive, and there's all kinds of deals that they're doing if you have a large portfolio of spaces. If you are considering doing one of these certifications, and then in that case, that certificate is free, different things like that. Happy to talk to you more about that information. That's enough for an entire session, which we don't have time for today. But I wanted to make sure that you guys are aware of these. We're seeing a lot of success with different spaces, a lot of people participating. One of the first spaces to go through WELL's health safety rating system is the New York Yankees Stadium. So when I say it can be applied to any space type, I'm very serious, and they're all policy-based. There's very, very little hard costs associated unless there are things like providing PPE or reducing this person-to-person contact or adding additional hand washing stations. And of course, signage, whether you're, buying a signage package that's a sticker so you can sticker it everywhere, or if you're just laminating a piece of paper you printed and putting that up everywhere. Educating is, the occupants that come into your space, letting them know what the rules are, letting them know what best practices are, is absolutely all over these certifications, and you don't need a certificate to know that that's certainly an important thing to do. Communication. This is the part you guys were all waiting for, right? The most important thing I want you to take away from this is that transparency is key. You have to be transparent with residents. Be transparent about what you're doing to mitigate their risk. Be transparent about what steps are being taken, and be honest and say that's what we understand is best practice right now, but that could always change because it's true and it's fair, and people have to respect that, right? But the more transparent you are, say you've set up some guidelines in a space, and then you are told that a resident who is in that space has contracted the virus. May or may not be because of what was happening in that space, but if you're honest with your community and you tell them, we're going to revisit this, we're going to make sure that we have, multiple things in place because we want to make sure that everyone's okay or that this doesn't happen again. Being honest like that, telling them, telling them that you're constantly going to be looking at this is really important. Sharing information and educating them about what they can do within their own space, since a lot of you, aren't really necessarily changing what happens within their own space, but educating them is at least empowering them, and you can hope that people are following these guidelines. For those of you who are leasing spaces, you can actually put this in a contract and tell people that they have to do it. And if they're seen, wearing a mask in a space where they are not wearing a mask in a space where they have to be wearing a mask, or having large group gatherings, you can and you do have power to somehow, penalize them for not following the rules, which is also something that will be seen, or, the word will travel, and they'll know that you guys are taking this seriously. So signage, again, use technology. I mean, there are some clients that we work with that I've seen, they typically have fitness classes at least a couple times a week, and they're not able to host those. So instead, they took it to Zoom, and then they started providing people who signed up with the login so they can do it from their own living rooms. And it's been really successful. Social media campaigns, fantastic. Use them to share information, to educate, and then also ask for feedback. Because if you want to know whether or not someone feels safe, they will tell you, but a lot of this is happening through social media sites. There are some people who go out of the way to, call or email, but social media is a very easy way for them to give you feedback, whether or not you want it. But consider the feedback, because again, these people are going to tell you if they feel safe or not, and if there are some things that they think are safe, even though we've talked about they aren't. You might want to consider introducing those as a part of your mitigation strategy if it's not cost prohibitive, I guess. Again, touchless systems. There's all kinds that I've seen that are, less expensive. In our building, they installed these little kick plates that you can use on the restroom doors to actually pull the door open with your foot rather than have to touch the door handle with your hands. I mean, there's all kinds of things. But there's a lot of technology that's popping up here and there with in regards to key card access. So if you're using a specific company, definitely reach out to them and see what it is that they're doing. Ask if they have anything that they're working on. Think about it. But really, there's nothing in terms of a piece of technology that is going to get you where you need to be, except for in-space air purifiers and some of the things that we already know about. Stay connected. Stay up to date. Information's changing all the time. If you're like me, I read this little shortened version of what's happening in the world every morning. And I know for the last couple of days, they've been talking about virus cases increasing. I did a little bit more digging this morning, and they're saying, well, in some areas it's getting colder, so people are moving indoors. And after what you've learned today, if you didn't already know, then you can understand maybe why some of these cases are increasing. But then there's also the potential that people are just over it and sick of it, because, who's not? And they're relaxing some of the things that they were doing earlier during quarantine. But, there's also, they're getting better at testing. So some people are saying, oh, well, it's only increasing because the testing technology has gotten better. And that's great, because we're hoping for some sort of vaccine, right? So I hope that our testing has gotten better, or more people are getting tested. But no matter how you shake it, even if you filter out all of that information, everything's increasing. But there's all kinds of research being done. One of the newest things that they're looking at are the countries where they used contact tracing, like Hong Kong. There's another country. They're sharing that information. One of the things that was very apparent right away looking at that information was that children may be super spreaders. And part of it's because they are typically asymptomatic or have mild symptoms. So, there's all kinds of things that you're doing, assuming that they're not sick, and all of a sudden everyone's contagious. And it's not a great thing, because, at the beginning of the pandemic, if you remember, they said children were less susceptible. But apparently that's not necessarily the case. And if you were under the impression, as I have a 7-year-old, that children were less susceptible, I was allowing him to do things that, as adults, we were stopping ourselves from doing. Playing with friends without a mask. To be fair, we had a little quarantine crew, so it wasn't tons of people, but still, there's all kinds of things happening like that. We've been in this situation for months and months, and some of us are going back to school and some of us aren't. And for those of us that are going back to school, it's really scary, because I just told you that a lot of spaces don't filter their air enough. And some of these spaces, they're asking kids to wear masks, and sometimes they're not. And if your kid's anything like mine, he touches it and he moves it, and then he moves it around on his face and is touching inside the nose part. And then he tells me oh, it smells funny, and I have to remind him that's your breath. So, it's a whole host of things. But there's going to be more information that comes from that. There's going to be more information that comes from what they're doing with immunizations. So dig into it if you are responsible for a large group of people, because it's really the best way that you're going to be able to protect yourself and your community. You know, this time of year, it's also flu season. So maybe after this, maybe within the next week, you put some information together about how people can get their flu shot, because what scientists and doctors are calling the next few months the twindemic, with the flu going around, multiple types of flu. The symptoms are very similar to COVID. And if, you know, I mean, especially I'm in Atlanta in the spring, everything's covered in yellow and there's pollen everywhere. But, you know, there was also the pandemic, and you wake up a little sniffly and you're like, oh, is it coronavirus or is it just allergies? The last thing you want to do is end up with flu and be freaking out as to whether or not you have the virus, right? So tell them there's so many places that are doing it for free. They don't have to have health insurance. Some of these places will even give you a gift card to use in their store. But if you tell them about it, if you remind them to wash their hands, if you remind them to wear masks and how to wear masks and what types of masks are best, then you know, it's a great way to reduce all potential virus spreading with everything that we're doing for SARS-CoV-2 specifically. Again, know how your building's ventilation system works. If you have more specific questions about this, please let me know. There is some pretty cool technology out there that is working in terms of being able to filter air that doesn't involve an actual piece of filtration media. Some of it does have the word ionize. So if you just installed this and you're freaking out that I told you that it's not a good thing, let me know, because there are some that are better than others. And most importantly, again, be the leader, show empathy, admit when you have areas of weakness, tell them what you're going to do to fix it, offer support. It can be, you know, I don't know, a service that will pick up trash at your front door if you're sick or if you're worried about, you know, making that trip. But it could also just be offering personal protective equipment for either guests or residents, or for, you know, someone that doesn't work in your space who comes into the space to, I don't know, fix a leaky faucet or something like that. And then commit to staying connected, because I think if you're sharing information that people are also reading about in the news, then it also shows that you are, you know, a couple steps ahead of the game. And with that, here's an email that you guys can use if you have questions specifically for me that you think of after this. But otherwise, we have about 15 minutes left to answer some questions, and I can't wait to hear what you guys are wondering about.
Lauren, that was an exceptional presentation, really informative. I have a question to kick us off, but I'm hoping we say a lot more questions in the Q&A. Please post them there. And this has to do with masks. I'm confused. There just seems to be so many different kinds of masks. You know,
yeah.
My husband's company sent out a package of masks that have a space in the back for a filter.
Yeah.
What are those effective? And would you,
yes.
what type
if
of
you
filter,
put a filter
to buy?
In there. PM 2.5. You can find them in packs of a bajillion. Now, they were a little harder to come by. They're typically used to help filter dust particles. They were used a whole lot in Australia, in California, when there's smoke in the air, because they're great at filtering pretty much everything. But PM 2.5 is the same as N95. And all that 95 means is that it's filtering at least 95% of the particles in the air, if not more. It's the same with HEPA filtration. There's when they test these products, there are certain size particles that can get through, and there are certain size particles that it's 100% effective at catching. And for some reason, they're really great at catching small particles and the majority of large particles, if not all. But then there's always this like tiny gap between the tiny ones and the bigger ones. And there's all sorts of thoughts behind why. But the actual virus particle itself is 0.12 microns. N95 is 100% effective at capturing and filtering that, as well as a HEPA filter. So that mask, that actual filter that's disposable, it's acting like a HEPA filter over your face.
Okay. All right. So some of the things you said were shocking. Just starting out that the virus particles can be 16 feet. So why aren't we seeing places requiring a larger distance? And it seems to like grocery stores and other places that have traffic flowing in a particular direction, people are just ignoring, and it doesn't seem like there's any kind of enforcement.
Well, that's just it, right? I think you guys saw when certain stores started requiring that everyone wear a mask. The first thing you see in the news are, like people filming other people getting into battles with security. The 6 to 10, I think 10 is still mentioned. 6 feet is certainly the case. That is most effective when it comes to someone sneezing, coughing, singing. If they're not wearing a mask, then there will absolutely be particles coming out. The virus, when it leaves your system, it sheds its body in your throat and in your nasal cavity, which is why when we, if you take the test, they're like swabbing way up in your, nose cavity, or they're like swabbing a couple times in the back of your throat. And they may or may not find, live virus particles, but if they find the shedded body or the dead body, then it's, it's understood that you have been contaminated. You may be contagious. The live virus particles, they're further down. And so when you're singing, when you're coughing, when you're sneezing, you guys have all seen the slow motion videos, right? Of like how far that can go and where it can cover. And now there's ones I'm seeing where they're showing like the way that the air circulates, like here's all the particles now floating around the room. It's the easiest measure. It's meant for that type of situation where we know for sure that is one way to spread a contamination, a virus particle that will probably most likely get you sick. But really, I don't know of many places where they could start saying, 16 feet or more. 16 feet is in that study as far as they went, and they were still finding virus, but it could spread further. So for example, oscillating fans, they can be both fantastic and really bad for helping any kind of air transmission. If they are taking contaminated air and like blowing it directly at someone or helping to spread it around an office, bad. If they're blowing fresh air or like clean air from one space to the next, then good. Or even, it doesn't have to be oscillating, just a fan placed in a window that's sucking outdoor air in. As long as you're not dealing with fires, like other things in the air, that's going to help dilute the air. That's great. But it just, it just kind of depends. I feel like the situation is too tricky, and really what you shouldn't be worried about the actual distance, because no virus travels, in a direct line, especially depending on how your air ventilation system works. Some air ventilation, the air comes out at the floor and then it goes back into the system up at the ceiling. And that's great because you're sending air from one space to the next, hopefully covering everything. But the air is going to do different things in the space, especially depending on the temperature, especially depending on the humidity. And, what we know about humidity and what we know about the virus is that the more water that's in the air, the more the virus will, attach to it because it likes to stay wet. It likes to stay, kind of mucusy and warm. But once that happens, it drops, and that's where the surface contamination happens. So, within your space, you could be 16 feet apart, but there could be very little humidity, especially as we're going into the winter months. And, most heat systems pull a lot of the humidity out before the air's put into the space. And now you're just spreading even more than you were in the summer. It's tricky. It's really tricky.
Okay. I could probably ask a million more questions, but I'd really love to hear from some of our attendees. We just have about 6 minutes left. So please, if you have a question for Lauren, now is the time. I feel like I'm hogging the conversation here, but you talked about the quality of devices for air circulation. And you said MERV 11 or better. What does that refer to? I'm not familiar with that.
MERV is the way that filtration media is labeled. It's an acronym. I forget what it stands for exactly. If someone in the audience remembers, don't hesitate to speak up. But using numbers tells you how much is being filtered from the air. MERV 11 can filter 60% of particulate matter that is sized 2.5 or smaller. Remember the PM 2.5 masks? Same thing, right? So as you go up in number, so like MERV 13 is 70%. HEPA is like, I think it's nearly everything. I think the highest MERV that I've seen is like a MERV 18, and that's pretty close to HEPA. I think the only thing above it is HEPA. But it's a system that they use to describe how much can be filtered with that filtration media. Filtration media is great, but you have to remember to clean it because it does get dirty and fill up, and then the amount that it's capturing starts to reduce. So if you have facility maintenance people, tell them to follow the instructions.
Okay, Sandra would like to know, how often should we change our masks during work hours or wash our masks? It's a good question.
That's a great question. So sometimes, wash your hands before you touch your mask, before you, touch any kind of food, before you touch your face, your mouth, your eyes, but certainly after you touch any surface that other people touch as well. But I think we could go beyond that and say anytime you touch any surface and you want to then go to another space, or you then want to eat or do something like that, because as you know, the virus can drop from the air and land on a surface. So it doesn't have to be high touch. But washing your hands often, great idea. Definitely when you're coming in from somewhere else. My son's great at it now. My Apple Watch will now start counting down. It knows when I'm washing my hands, which is fantastic. But I think what's more important than how often is that when you do it, make sure you're washing them appropriately. Google hand washing signage. There's all kinds of graphics that I've seen that tell you, like, make sure you get the backs of your hands and your thumbs and your fingernails. Doing this with soap or hand sanitizer is a great way to make sure you get it under your fingernails, which is definitely a space where things can get trapped.
And what about masks?
In terms of masks, it definitely depends on how long you've been wearing it. I would say that at the end of every day, if you've been wearing it for 8 hours or more, either switch out that little filter that you have inside and replace it with a new one. If it's the disposable ones, then start over fresh. If it's a cloth one, you need to wash it at the end of every use. I'm super nerdy, self-proclaimed nerd, so I'm comfortable in that space, but I actually made a filtration box, which is just a storage box that I lined with tinfoil, and I put a UV light in there that has a timer. And if we only wore it like, I don't know, out for a minute, or like drop my kid off with his COVID pod, then I'll throw it in there when I come back. But at least once a week, I wash everything. I hope that helps answer your question.
Okay. Mary said, talking about community space, we are open during office hours. We require masks and we limit the amount of residents, but we do not have screening in the rooms. What else have you heard, please?
Screening isn't going to stop the fact that this is an airborne virus. So screens in place, you're okay. Don't worry about that too much. Just wash your hands often if you're coming into contact with people or having to exchange materials that they're giving to you. I'm wondering, I don't know. I mean, I would definitely look in these community spaces and look at what your air ventilation system is doing in those spaces, at least. But it's everyone's putting themselves at a certain level of risk. It all depends on what they're comfortable with. But I think everybody would agree that for a senior building, maybe not a great idea, especially since that's where a lot of contagions have been spreading really easily, really quickly. And I'm assuming a majority of your residents are high risk. Now,
Mary did note also that these are senior buildings.
Yes, yeah, I see that. But there's certainly a lot to be said from a mental capacity, being able to be in a space together. So, I mean, first of all, I'd measure the spaces, know what the square footage is, and look at some air purifiers that you can put in the space. I've seen ones that you can rent from companies that are super reliable that will cover up to 5,000 square feet. And if you have a community room that big, then I want to know where you guys are, because that sounds like an awesome space. But I think that's probably one of the best things you can do, but definitely keep people wearing masks. That's really, it's going to be your safest bet. Okay. Have other companies opened their space? I'm not sure what you mean, Mary.
Opened community spaces?
Are you guessing?
Yeah.
Yeah. Yeah, there are some that never close them. It just kind of depends on the space, but I think what you find is most people aren't using them. Common spaces, yeah. The one that I know that people are most focused on trying to reopen are fitness spaces. And you need a lot of air ventilation in those spaces, a lot. Especially if you're going to allow people to take off their mask. Honestly, in my opinion, unless you have some garage doors you can roll up or windows you can open, it's not safe. And I would still wear a mask, unfortunately.
Well, Because we're in this for a while longer for sure. So this is all
Yeah.
really good information, Lauren. I really appreciate your time once again today. And thank you again to Colorado Security Group for sponsoring this session. And thank you to attendees
Yes.
for coming
Thank
in
you,
and joining
attendees.
us here in the auditorium.
Awesome.
Thank you very much.
Thanks, everyone. Enjoy the rest of the conference.
Thank you.